Oh, how we love our carbs. But after weight loss surgery, watching how much carb you eat is important in your successful journey. Can you cut carbs in baked goods and snacks that you buy or make without losing flavor? Yes, you can. Have you heard of almond flour? Did you know it's bariatric friendly? Plus, it has numerous health benefits that you're going to like. I'll share at least 5 coming up. Don't go anywhere.
Looking for an easy-to-swallow multivitamin that also smells good instead of vitamin-y? Check out the once-a-day easy-to-swallow tablet from ProCare Health with new scent certs. The orange scent inside the bottle makes supplements not only smell better, but taste better, too. It's a whole new way to experience your once-daily vitamin. Visit ProCareNow.com and use code Susan10 to save 10%.
Hi, I'm registered dietitian nutritionist Dr. Susan Mitchell, ex-radio dietitian turned podcaster. You're listening to the Bariatric Surgery Success podcast, episode number 159. Frustrated with the confusion and all the misinformation when it comes to nutrition, especially bariatric nutrition. There is so much of it online. Eat this food. No, don't eat that food. Fast. Do the keto diet. Hey, just reset your pouch. It's enough to make you throw up your hands and shout, "Help me. I don't know what to do." Well, I do. I know what to do. It matters where you get your nutrition information. When it comes to bariatric surgery, especially your bariatric surgery, nutrition is specific. So let's cut through the hype, all that nonsense online, and get the accurate information that you want right now, strategies that work. I want you to feel well every day, get out there, do the things you want to do. And really, that's why I created the Bariatric Surgery Success podcast. It's for you. You're in the right place. I'm glad you're listening. And if you love the podcast, would you share it with someone you feel would benefit? And write me a review on Apple Podcasts. I would really appreciate it. Okay, before I jump in the podcast, are you dealing with dumping syndrome today? Maybe a stomach ache, sweating, have a headache, some dizziness, even diarrhea. Experiencing dumping syndrome, no fun. It wrecks your day. It interferes with your weight loss journey, but there are things you can do. So I've got 4 tips that you can try right now in my freebie. I'll put the link in the show notes for you. We love them and we hate them, right? Carbs. But how much you eat is an important part of a successful journey after weight loss surgery. The question I asked a couple of minutes ago is, can you cut carbs in baked goods and snacks that you buy or make without losing flavor? The answer is yes, with almond flour. Almond flour is made from ground almonds, and it can replace traditional wheat flour in most any recipe. So think about wheat flour. It's used in so many foods, from breads and pastas to cookies and snacks, and it's a source of carbs. Almond flour is higher in calories due to the higher fat content from the almonds, but it's lower in carbs, so it works really well in a bariatric lifestyle. But portion size always remains important because of these extra calories coming from fat. Good news, when it comes to feeling full and satisfied, almonds take longer to digest because they do contain that protein and fat and fiber. This great combination helps you feel full longer, and it helps you eat less. So let's look at what 1/8 of a cup of almond flour contains. And that's probably the amount you might find in a bariatric portion. So you'd be looking at about 85 calories, 3 grams of protein, 7.5 grams of fat, and that's compared to less than 1 gram in wheat flour. Because remember, the fat's coming from the almonds, not in the wheat flour. But here's the big difference. Carbs, 2.5 grams compared to 10 grams in wheat flour. So this is why almond flour works so beautifully to help you cut those carbs. And again, in this 1/8 of a cup, you've got 1.5 grams of fiber versus zilch in white flour. So it's easy to use almond flour when you're baking. In most cases, you can simply replace the wheat flour with almond flour in any recipe in a 1-to-1 swap. But here's some things that I've noticed when I use it. Sometimes with the baked goods made with almond flour, they're not quite as fluffy as those that contain wheat flour. So Why is this? Without the gluten from the wheat, baked goods rise less, and so they're a bit more dense. They're equally as delicious, just a different dense texture. It's also important to note that almond flour may require a little bit more egg in order to bind that flour. So what I typically do when I want to play with it in the recipe is I'll replace a fourth of the flour, maybe a third with almond flour the first time out. I really want to see how that recipe does before I go all in and do it 1-to-1, because I might find I need to play a little bit with the egg, the amount of egg, or it might be a little too dense. So it'll just depend. But I actually use almond flour in various ways that you might want to try. If I'm making pancakes, then I'm going to swap out almond flour instead of using wheat flour. If I bread shrimp or I'm breading fish, I'll do this with almond flour instead of breadcrumbs. And this works really well too if you're making meatballs. So instead of breadcrumbs, I will use almond flour. What about banana bread or pumpkin bread? Yes, I will substitute in some almond flour there. So if you're wanting a dessert on occasion that has a lot of almond flour, think about macaroons, because traditionally that's what they're made with, is almond flour. And remember, because it is gluten-free, it's a good option if you have celiac disease. But there's more. So what about all of those health benefits of almond flour? So here are at least 5 more things to know about. Let's go back to that 1/8 of a cup used in baking. So that has 3 grams of protein. So it's a nice way to add more protein into your day. And then number 2, it has fiber. Now, some of the fiber acts as prebiotic fiber. Well, this means that this type of fiber is food for the probiotic bacteria in your small intestine. So it leads to a healthier digestive system. And of course, fiber is terrific for what? To prevent that big C, constipation, right? Always something you have to be thinking about. Number 3 on health benefits, almond flour contains a healthier type of fat known as monounsaturated, and that monounsaturated fat coming from those almonds. Number 4, low carb. As we talked about, that 1/8 of a cup of flour has 2.5 grams of carbs versus 10 in wheat flour. So this is why it's fun to learn how to use it. And number 5, it is quite a nutrition who's who. For example, almond flour does contain, and this is because, let me just say, it's in the almonds, vitamin E, manganese, magnesium, copper, phosphorus, some calcium, and some iron. And actually magnesium, you've probably heard, good for helping with your blood glucose control. So that makes almond flour a good choice if you have diabetes. So here's what I want you to do this week. If you're multitasking, listen closely. If you like to bake and you like to cook, try almond flour in one of your recipes this week. Tell me how you use it and tell me how it worked. You can contact me directly on my homepage, breakingdownnutrition.com. You'll see the contact us, or you can post it to any of my social media, show us a photo. If you don't bake or cook a lot, look and see what items you might purchase and try that are made with almond flour, such as some almond flour crackers or an almond flour baking mix for banana muffins or pizza dough. Be sure and read the labels closely, because it might not be all almond flour. They might have other sources of carbs. So you want to look for the ones that are going to be lower carb. All right. Stay focused on your journey. And remember, you are worth it.
Bariatric Surgery Success with dietitian Dr. Susan Mitchell is produced and owned by Practicalories, LLC. All rights reserved. Remember, the content provided on this podcast is for information purposes only and doesn't create a patient-provider relationship. It's intended to provide reference material and is not designed to provide medical advice. Please consult your healthcare provider regarding any medical issues you have relating to symptoms, conditions, diseases, diagnosis, treatments, and side effects. Podcast guests express their own opinions, experience, and conclusions which do not necessarily reflect or agree with the host, Dr. Susan Mitchell or Practicalories, LLC.